Phlebotomy Practice Test 2026. Question 1. A patient's vein collapses immediately after blood begins flowing despite correct needle placement. What is the most appropriate corrective action? Tighten the tourniquet. Increase tube vacuum. Ask the patient to pump their fist. Switch to a butterfly with syringe. Vein collapse occurs when negative pressure exceeds vein strength. A butterfly with syringe allows manual suction control, reducing pressure on fragile veins. Question 2. Which pre-analytical error most dangerously alters potassium results? Drawing from a cold arm. Delayed transport. Hemolysis during collection. Mild dehydration. Hemolysis ruptures red blood cells, releasing intracellular potassium into plasma. This falsely elevates potassium and can mimic hyperkalemia, leading to inappropriate emergency treatment. Question 3. A patient reports sharp electric-like pain radiating down the arm during needle insertion. What must the phlebotomist do immediately? Remove the needle. Slow blood flow. Reposition the needle. Apply pressure. Radiating or electric pain indicates nerve contact. Continuing risks permanent nerve damage. Immediate needle removal is the only safe response. Question 4. Why must sodium citrate tubes be filled to the indicated volume? To maintain blood to additive ratio. To preserve platelets. To prevent clot formation. To reduce hemolysis. Coagulation testing depends on an exact blood-to-anticoagulant ratio. Underfilling creates excess citrate, falsely prolonging PT/INR values. Overfilling causes inadequate anticoagulation. Question 5. Blood cultures are most likely to be contaminated when which step is performed incorrectly? Tube inversion. Stopper disinfection. Skin antisepsis. Tube labeling. Skin flora are the primary source of contamination. Improper skin antisepsis introduces microorganisms causing false positives, unnecessary antibiotics, and extended hospital stays. Question 6. Leaving a tourniquet on for more than 1 minute most directly causes which issue? Dilution of plasma. Hemoconcentration. Platelet destruction. Reduced blood flow. Prolonged venous stasis forces plasma out of veins into surrounding tissue, concentrating cells and analytes. This falsely elevates potassium, proteins, calcium, and hematocrit. Question 7. Which vein is preferred first for routine venipuncture and why? Basilic due to size. Cephalic due to accessibility. Median cubital due to stability. Dorsal hand due to visibility. The median cubital vein is large, well anchored, and located away from major nerves and arteries. Its stability reduces rolling, pain, and complication risk. Question 8. Why must alcohol be allowed to air dry before venipuncture? To reduce stinging only. To avoid hemolysis and contamination. To increase blood flow. To prevent clotting. Wet alcohol can enter the puncture site causing hemolysis and specimen contamination. It may also cause burning discomfort. Drying ensures specimen integrity and patient comfort. Question 9. Which additive best preserves cellular morphology for hematology testing? Heparin, EDTA, sodium fluoride, sodium citrate. EDTA prevents clotting by binding calcium while maintaining red and white blood cell structure. This makes it essential for CBCs and differentials where cell shape and count accuracy are critical. Question 10. A specimen arrives at the lab without a collection time. What is the correct action? Estimate the time. Ask the nurse. Reject and recollect. Process anyway. Missing identifiers compromise specimen integrity and violate patient safety standards. Collection time affects analyte stability and result interpretation. Recollection is required for traceability. Question 11. What action best prevents hematoma formation after needle removal? Immediate bandaging. Firm pressure until bleeding stops. Rapid needle withdrawal. Elevating the arm. Applying firm pressure allows the punctured vein to seal properly. Failure to do so allows blood to leak into surrounding tissue, causing bruising and swelling. Question 12. A patient on anticoagulants requires venipuncture. What adjustment is essential? Use smaller tubes. Prolong pressure application. Reduce vacuum. Draw from hand only. Anticoagulants impair clot formation. Extended pressure prevents prolonged bleeding and hematoma formation, which are common complications in these patients. Question 13. What is the most common reason specimens are rejected by laboratories? Hemolysis. Clotting. Improper labeling. Insufficient volume. Even a perfectly collected specimen is unusable if patient identification is incorrect or incomplete. Labeling errors pose serious patient safety risks and violate regulatory standards. Question 14. Why is the basilic vein used cautiously? It collapses easily. It has poor blood flow. It lies near nerves and arteries. It clots quickly. The basilic vein's proximity to major nerves and the brachial artery increases the risk of nerve damage or arterial puncture if accessed improperly. Question 15. Forcing blood from a syringe into a tube most often causes what problem? Clotting. Hemolysis. Dilution. Platelet activation. Excessive pressure during transfer damages red blood cells, causing hemolysis and invalid laboratory results. Gentle pressure through the needle's natural angle is essential. Question 16. Which tube must be drawn first in the order of draw? Light blue. Serum. Blood cultures. Lavender. Blood cultures are drawn first to prevent additive carryover and minimize contamination, which is critical for accurate microbial detection. Question 17. Why should fist pumping be avoided during venipuncture? It alters analyte concentrations. It causes pain. It slows blood flow. It causes clotting. Repeated fist pumping increases potassium and lactate levels, leading to falsely elevated results and inaccurate diagnosis. Patients should remain relaxed with hand in a neutral position. Question 18. What is the primary purpose of anchoring the vein? Improve blood flow, reduce pain, prevent vein movement, speed collection. Anchoring stabilizes the vein, preventing rolling and reducing tissue trauma. This improves first attempt success rates and patient comfort. Question 19. Drawing blood above an active 4 infusion most commonly results in what error? Hemolysis, clotting, slow flow, dilution of specimen. For fluids dilute blood components, causing falsely low laboratory values and inaccurate clinical interpretation. The opposite arm should always be used when possible. Question 20. Which needle gauge is standard for adult venipuncture? 18, 20, 21, 25. The 21 gauge needle provides adequate blood flow while minimizing vein trauma, making it the standard choice for routine adult venipuncture. Question 21. Swelling during blood collection indicates which complication? Hemolysis, hematoma, petechiae, infection. Blood leaking into surrounding tissue causes swelling and bruising, indicating a hematoma. This requires immediate needle removal and firm pressure application. Question 22. Why must additive tubes be gently inverted? To activate additives, to cool the specimen, to mix additives evenly without damaging cells, to speed clotting. Gentle inversion ensures proper mixing while protecting cell integrity. Shaking causes hemolysis and invalidates test results. Question 23. Which tube preserves glucose levels by inhibiting glycolysis? Gray, green, lavender, blue. Gray top tubes contain sodium fluoride, which prevents glucose breakdown after collection. This ensures accurate glucose testing, especially when transport may be delayed. Question 24. What is the safest position for a patient with a history of syncope? Standing, sitting upright, supine, leaning forward. Supine positioning prevents sudden drops in blood pressure and reduces fainting risk. For patients with known vasovagal responses, drawing blood while lying down is strongly recommended. Question 25. Why is proper order of draw critical? Prevents additive carryover, reduces pain, saves time, improves labeling. Additive carryover can dramatically alter test results, leading to dangerous clinical errors. Following the correct order protects specimen integrity and patient safety.